PT is one of the most loved and respected and appreciated professions from patients, but we do have the specialist designation, and that is a big barrier to physical therapists finishing out care with their patients. PTs can't do athlete physicals. Chiropractors can, so was a little strange.
We need to be able to catch cancer. We need to be able to catch fractures. Like, we are the only profession that sees people through multiple weeks, and we can see when something's not responding well and act quickly.
Where does payment affect our private practices or our PTs the most?
If you go to a PT first, it can save you as the consumer $25,000. We passed a bill to become primary healthcare providers. Do not miss this next conference. This conference is crucial to know what this truly means and educating you on what you can do to take it to the next level. PT is the best kept secret in healthcare. Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, build a community of trust in quality healthcare, and achieve lasting wellness. I am your host, Brad Powell, doctor of physical therapy and owner of an award-winning clinic here in the Salt Lake Valley. Each episode, we dive into all things rehab, injury prevention, overall health, and bringing you expert insights from leaders across various healthcare fields. Please note that while we strive to provide the best knowledge and advice, the opinions shared are those of the guests that we represent on this podcast and do not replace professional medical advice. So let's revolutionize healthcare and wellness together. I am so excited for our podcast today. I have with me Katie Mansell, who is the executive director of the Utah Chapter of APTA. And she has been leading from the front and doing all of the hard work to get us to the point where we passed a bill to become primary healthcare providers. And we're going to talk all about what that bill means, and we are so excited to have her. So welcome, Katie, to the podcast.
Thank you. Super excited to be here. I'm really ready to talk about this. It's been a really exciting process, and I think it's going to be a good progress for the profession.
Absolutely. I can't even underestimate how much work has gone into this. And Katie has put in so much time and so much effort, and
a lot of people have.
Yeah,
not just me.
and in the beginning, I mean, talk to us about the level of effort and study that you had to put in even before you got other people involved.
Yeah, so about a year ago, I had a conversation with our chief delegate, Howard, and he was talking to me about the rural areas of Utah, and we approached the topic of athlete physicals, and right now in Utah, PTs can't do athlete physicals. Chiropractors can, so was a little strange. So I started to research that a little bit. Along the same lines, we were looking into the DOT medical examiner route and if that's allowed in Utah regulation. During these two conversations we were having, the specialist designation in Utah was brought up to me, and tell
us what that means. What does the specialty designation mean?
So in Utah, we have, primary care providers, and that's physicians, PAs. I can't remember the exact list of who's on that, but then you have the specialist designation, and those are essentially, sometimes they have to be professions that in order to see them, you have to get pre-authorization. They have higher copays. There's often limitations with insurance in accessing these specially designated professions. And so PT is one of those. Although we've had direct access since the 80s, we still maintain that specialist designation, which...
And direct access meaning consumer can come straight to physical therapy without a referral.
For the most part. I mean, payers, insurers have unique ways of trying to get around that, and we've seen that increased a lot lately with them requiring, different forms of prior auth or physicians signing off notes and things like that. So we do have direct access, but we do have the specialist designation. And that is a big barrier to patients, to physical therapists finishing out care with their patients, and to, even the healthcare system, because we have seen you have patients who go see their physician, and I think the data we've seen in Utah locally is 40% who are referred to PT end up dropping off. And so our hope is to...
So before they even get to the physical therapist.
They go to their physician, and before they even move to their physical therapist, 40% of them drop off. They don't even make that appointment. They don't even go see their PT.
Yeah.
Oftentimes, they could end up back at their physician. So it's a barrier to patients. Obviously, a barrier to the healthcare system. It increases costs. Patients who have to go see a PT have a much higher copay, often 15 to 30.
Yeah, and they're paying a copay at every single visit rather than just one time. It's 12 visits they're paying that copay.
I like to think of it in the fact my mom had surgery on her knee, and in order to rehab that knee, she had to go see a PT for 6 to 10 visits. She's paying a copay just to rehab a knee from a surgery she's already had every single time.
And she already paid the whole deductible.
She already paid for the surgery, but the insurance, we went through all that. But every time she's going to see her PT, it's frustrating because she has to pay this $40 to $50 deductible. And so...
Copay,
yes, yeah. Sorry, copay. And situations like that, I feel like that should just be part of the the recovery, the quality, the care you receive, especially for a major surgery like that. But
you've already met your deductible. You should be able to get all the therapy after the surgery and not have to pay any additional fees.
Yeah. And so there is a significant barrier to seeing PTs.
A lot of people think that the PT clinics are charging that additional copay, but it's really insurance companies that require us to pay that copay. I can lose my contract with insurance companies if I don't charge that.
Yeah. And so we are trying to remove that specialty form so you don't have that higher copay, and PT physical therapy is more in line with when you go see a physician. There's so much data out there to show that physical therapy actually costs the healthcare system less. It saves the healthcare system money if people were to just go see a PT as their frontline provider.
Yeah, I remember APTA nationally put out an economic report, and it just you look at the cost savings. Even for something like carpal tunnel, I believe it was around you can save up to $25,000. I mean, it's in the report, but it's something along those lines. Yep. If you go to a PT first, it can save you as the consumer $25,000. Yep. And you end up with the same result as if you're going down all these other routes.
Well, you get your care faster, and you get it with less cost, and you get to live your full life sooner because you're receiving care quicker. But often, we have that often people believe that physician referral to PT is so important. But if we have people just going to see their PT, I mean, you're going to have way more success with some of the concerns that PT can address by just seeing your PT first. And
absolutely
removing that middleman or that middle process is going to be really important going forward.
Yeah. So we're going to come back to kind of this evolving story of how this started and how it went, and then how it's going now, and the initiatives that we're going to take moving forward. But for the consumer, a patient that's coming in, and just all of Utah, and then nationally too, what does this mean for the patient? You kind of talked about a few things, but just kind of highlight, what does it mean for them?
I mean, I will say we have some work cut out for us to educate patients and the public still. I mean, we've had direct access since the 80s. People don't know that still.
Oh, yeah. People texting, emailing all the time. Do I need a referral from my physician?
Yeah.
And you're like, no, we've been doing this since the 80s.
Yeah. It's something that has not caught on like you would think it had. So I think we're going to be putting out some education for the public and patients that, you have direct access. Not only do you have direct access, but we would love to see patients advocate with their employers and with their insurance companies to improve and expand access to physical therapy. PT is one of the most loved and respected and appreciated professions from patients. And it's a tribute to who the PTs and PTAs are who work into this because they care so much. And I think patients could be the best advocate in getting better access to PT. So our hope is that we can help support that effort. Our hope is that it will save them money, and it'll increase their utilization of PT, which will decrease injury and decrease, obviously prescriptions, opioids, surgeries, imaging. PT is known across the board to be a cost saving for all of these things. And a replacement for all of these things.
Yeah, absolutely. And what I love about this bill more than anything else is it really puts emphasis on the importance of conservative care first. and making sure we are going through that process. I mean, around 80% of musculoskeletal injuries can be solved in physical therapy.
Yeah.
But yet these 80% think, they get shoulder pain. They're like, I got to go see a specialist. Then you end up going to your primary care. You get referred to a specialist, who's probably a surgeon. And then they say, well, you got to do PT first, right?
Yeah.
And why
and
would
you
they
pay
do
all
that?
those copays
Yeah,
first.
and you just went through 6 weeks of work and you end up coming back to us anyways, right? And then 80% gets solved here regardless.
Yep.
And then the 20% get back to the specialist, right? But we could save people so much time as the consumer and go through that process and go through PT, and then we know if you're appropriate for that surgery. We know if you're appropriate for that injection or whatever else, but it's the emphasis on conservative care. And I watched this bill go through, both through the House, through the Senate, all the steps. It's a pretty gruesome process, I'm not going to lie, to watch it. But it passed unanimously at every single step. So you know that these
shocked.
senators and all these politicians are in full support of conservative care. Tell me how that made you feel as you went through that process and saw those steps, and just like there was literally almost no pushback.
Yeah, that was shocking. Anytime you go through a legislative process, you have to anticipate there's going to be pushback, or there's going to be, other sides of the aisle. So when we had this initial conversation, we discussed what the opposition view is going to be. And so we kind of knew what we were walking into and thought it was going to be a very big battle for us. But shockingly and surprisingly and, honestly, refreshingly, I said at the very end of the session, it was so beautiful, and I don't know what the right term is for it, but I think of it as beautiful, seeing how many legislators supported physical therapy and how much they appreciated it, how many of them have their own physical therapist already.
Yeah.
And just the support for physical therapy, it was wonderful. I can't even find the right word for it, but so when we started in the process, we prepared for some, opposition, and as we went through it, it kind of faded, and there wasn't really much to oppose. Yeah. It made sense to everyone that we interacted with that physical therapy should be frontline providers as primary care.
What was any pushback that you got? What was the pushback?
Oh, we had, it's always interesting to see what comes out, because then you really know what other areas think of the profession. So we heard that PTs don't do preventative.
I remember when you told me that, I just laughed. I'm like, what do you mean?
Yeah.
That's all I do all day long. Come watch me treat patients. That's all we do. We don't diagnose and we don't treat, or we don't prevent. Yeah, right. That's literally all we do.
Yes. And I think some of the talking points were often, it felt like it was from 30, 40 years ago, because the PT profession has expanded and grown so much that I think some had the understanding of what it was 30 to 40 years ago. But there's so much preventative work in PT now, and rightfully so, because if we can do more preventative work, then we're dealing more in the front aspect of physical therapy rather than after something happens, right? And so that was one. There was a concern about diagnosing, and in Utah we do have statute that says you can't diagnose disease, but they were indicating we couldn't diagnose anything. And
a tendinopathy or
that all
tendinitis,
diagnosis had to come from a physician. And so,
which, I mean, in that defense, physical therapy diagnosis is typically a movement related. Yeah. We could typically say it's a tendinopathy or a tendinitis of the rotator cuff, but ultimately it's a movement dysfunction. So we typically will say that's a mobility deficit, right, where you have adhesive capsulitis. We don't really we don't use the term adhesive capsulitis in the PT world, but we will say there is, mobility deficit disorder of the shoulder, right? Which is really interesting, right? It's the same diagnosis.
Yeah. And I think that that's just a different understanding of professions, of what they can do. And I think that in the healthcare system, we should be working more towards, collaboration and, boosting each other's professions up to the highest level of their scope.
Yeah.
Rather than just
taking each other down.
Yeah, trying to say, well, you can't do this or you can't do that, or that's my role. And, the interesting thing is, physicians even are so supportive of physical therapy.
Mm-hmm.
And physical therapists are incredibly appreciative and respectful of physicians and the role that they play, often to the point where they're more careful with, things they might diagnose or things they might recommend because of they value the physician's input. Yeah. And physical therapists know their role. They know when it's not something that it's within their scope.
Yeah, the other day I had a patient come in, and this patient had a total knee replacement, and we were doing his rehab on his knee, and he happened to actually fall and tear his rotator cuff as well. And it was like day 2 after his surgery. So I'm working with this surgeon on timing with his knee to make sure he can get around well, because he's really early on, but getting surgery on his shoulder as well. And this patient came back after his appointment with his surgeon, and I know the surgeon very well. And he said, the surgeon doesn't want me to do anything for 6 weeks. He just wants me to sit at home and not come to therapy and literally do nothing. And I love this surgeon. I know him very well. And I said, that doesn't sound like Paul. It doesn't sound like Dr. Fenton. I'll reach out to him. We'll make sure we're on the same page. I text, the surgeon. Literally within 2 minutes, he texted me back. And I said to the surgeon, I said, hey, are you okay if we continue therapy next week after his surgery? And I gave him some specific parameters that we're working with. We're going to make sure we're not moving that shoulder at all. And he says, yes, absolutely. We should not stop. Right. So, I love this idea of rewriting healthcare, right? This podcast is all about the healthcare revolution. Mm-hmm. This revolution is about change, and it's about everyone working collectively together. And so many people are fighting for this driver's seat, right? It's like, MDs want to be there, PAs want to be there, PTs or chiros. It's like, in my mind, the only person in the driver's seat is the patient. We're in the car with them, and we're helping them navigate this complex system, and we're a team. Tell me what you feel and your thoughts on this team approach.
I think that's the only way the healthcare system survives at this point. I think that there's so many professions are getting elevated and educated, and we need to find a way to respect that and to appreciate it and to allow them to do what they're trained to do. And PT specifically, I think the profession has been undervalued and underappreciated for so long.
We are the best kept secret in healthcare.
Yes.
I heard that quote the other day. I'm like, you're right.
It's not just with patients, it's with payers who don't understand how much PT will save them money. And I am honestly shocked. Mm-hmm. You look at the Department of Defense and how they implemented PT and how that saved them a lot of money. And it's been very impactful for them. I'm honestly shocked that other payers aren't following suit, that they're not out there learning and discovering that PT is going to save them money. Mm-hmm. And then I think for PTs themselves, they often don't have the confidence or the belief in themselves that they can be primary care.
Yeah,
and they can be elevated to the NPs, to the PAs. You are educated and you are a strong profession, and you know what you are so valued that you should think of yourselves along the same, just a step below physicians.
Yeah.
And I think it's hard transitioning that thought process in some of our own professionals.
Yeah, absolutely. I was reading some research the other day that talked about these protocols that surgeons hand to physical therapists. And if you know about the evolution of physical therapy, we used to have associate's degrees, and then we had bachelor's degrees and master's and now doctorates, right? But a lot of these protocols that surgeons give us, all due respect to them, they're not research driven. And they're directing these PTs in a way that they don't think about what they're doing. And ultimately, we have to be the experts, and we should be coming up with the protocols to say, this is in my expert research and opinion, this is where we need to go with this surgery, right? ultimately surgeons are experts in surgery. They are not experts in rehab.
Right.
And that needs to change. That needs to be rewritten. Right. And PTs need to believe that they have the expert knowledge of any case to be able to take where they currently are to where they need to be. I was talking to Elizabeth Lane, who's a fellowship-trained PT, and she's on faculty up at the University of Utah, about some thoughts here, and she gave me some really good insights. She said, PTs, you either need to be confident or you need to get confident. Because the way the profession's moving, you need to keep up. Yeah. And you got to do the simple things well. We need to be able to diagnose, we need to be able to catch cancer. We need to be able to catch, fractures. Like, we are the only profession that sees people through multiple weeks. And we can see when something's not responding well and act quickly. Mm-hmm. I had this patient, wild story. I had this 42-year-old gal in my clinic. It was actually one of my friend's wives. And saddest story, but she came into my clinic, and I treated her for 4 sessions. She had some back pain. She had lifted up a weight wrong at the gym, and she had some cultural language barriers, and her husband was translating for her. And 5th visit, she was doing a little bit better through the 3rd and 4th visit. She came into the 5th visit, and she was worse. She said she was laughing with her friend the night before, and she was in excruciating pain. And her husband was kind of carrying her into the clinic. And I just said, this doesn't seem right. And I immediately sent him for an MRI. And the radiologist called me as soon as she was done with the MRI and said, this patient has cancer. It has spread to her entire spine. She has 17 fractures in her spine, and 2 of them are unstable. What do you want to do, right? And this is my patient. I'm primary care in this role, right? Yeah. So I call my patient, which is, the husband, my friend. And I just told him, I said, this is going to change your life, the news. And I'm so sorry, but you need to go to the emergency room right now. She has an unstable fracture. She has 17 fractures in her spine, and it needs to go through this. I don't know what cancer it is, but there is a cancer involved, and we'll let those experts handle it. And then I contacted a surgeon that I knew. I got this whole team involved. And unfortunately, this patient died 4 months later and left young kids. But really sad story, but we did everything we could for her, right? And that's what the profession is about, is we have to recognize when things are not right in our profession. We have to act quicker. Our profession is kind of been notorious. There's been some of us that just drag out plan of cares when people aren't getting better. And that's not good for the healthcare system. That's not good for our profession. We have to recognize when things aren't responding appropriately and then act. Yeah. And I think that's so crucial.
I do love what you said, though, about being experts, because I often feel like PTs don't feel like they're experts as much as they should.
Yeah. Absolutely. And we know more about the musculoskeletal system than any other profession, right? I mean, MDs, they spend a couple weeks on the musculoskeletal system. We spend 3 years, in depth. Like, we know the muscles, tendons, ligaments better than any other profession. And we are the expert. We just have to believe it. Yeah. And know it. So let's talk about this evolution of the bill. I think, a lot of people are wondering, like, how did this evolve? You did all this research, you had all these ideas come together, and then you brought this work. Tell us about this work group and that evolution.
So last July, we went to the APTA conference. I can't remember what it's called. There's a payment conference. Oh, it's the House of Delegates, that they do their leadership congress. And Justin and I, who's the APTA Utah Chapter president, we're sitting in meetings, and there's always, the hottest topic is always payment. Everyone wants APTA to make moves on payment. And so we're sitting there, and honestly, APTA Utah hasn't done a ton on payment in the last, at least in the 10 years that I've been with the chapter.
By payment, you mean improving
reimbursement
rates for physical therapists.
Yeah. Or, any work much with payers to advocate for the profession. So
you think about PAs, NPs, they make so much more than physical therapists, and physical therapists have more schooling. Yes. Right?
Yeah.
Doctoral degrees.
Oh, yeah. And that's something that, in my vision, like, elevate the profession to the respect and the pay of PAs and NPs. Like, that's where PTs should be. So in these meetings, I just started to have, some thoughts about what we do locally And as I'm listening to all these people stand up in the House of Delegates talking about payment, I think to myself, where does payment matter the most? Where does payment affect our private practices or our PTs the most? And I know that nationally we have a trickle-down effect that we hope that movement payment nationally will trickle down to the states. But most states have payers who are either geographic or local and aren't technically dictated by what national does. I mean, they will follow suit sometimes, but it kind of dawned on me that payment really matters and affects our profession the most at a local level.
Mm-hmm. It's so hard to make these payment changes on a federal level.
Oh, it's so hard. And APTA does an incredible job. They have some incredible people working nationally to work on payment, but we as a state level are where we're going to help our professionals the most.
Mm-hmm.
And I mean, I probably should have had this aha moment much earlier in the time I've been with APTA Utah.
Yeah, you've been with them 10 years. And you've done incredible work along the way.
I mean, it's not my expertise. And it's something so foreign to me that it was hard to learn.
Well, and that's so good for individual states to know, because I think individual states in your position are like, this seems like a bear
it's
that
huge.
I have to tackle. And knowing your experience, like, you didn't know a lot about this.
No. And I don't bill, like I don't own a clinic. I'm not a PT. So I'm not in the trenches every day knowing it.
Yeah. Talk to us about what you did to get those experts in the room to be able to have these discussions.
I just decided in those meetings, I was like, we need to try and bring in some of our most impactful, like our influential private practices in Utah. We obviously didn't capture all of them because there's so many more that we have in Utah. But we brought a group of probably 15 different private practices and individuals who have had
most
experience
likely
in it.
Represent thousands of, I mean, maybe I'm misquoting, but how many PTs would that group represent?
Oh, I would probably say a couple thousand.
Yeah.
PTs, PTAs.
I mean, you got 15 CEOs, owners of private practices that represent thousands of PTs across the state.
And so we came home from those meetings. I talked to several people and tried to get a list of people who would not only just care about this, but who would have the energy and the passion to really put some movement behind it. Because we often have people involved and, everyone is busy, life is crazy, but there's not really that passion or that motivation to actually see the change through.
Mm-hmm.
And so we got a list of people, some people came from my initial list, some people came after they heard that we were meeting.
Mm-hmm.
So we met the 1st of September and we all just sat down. And I will say, like, it was pretty amazing how much everyone cared about it and how the commitment everyone gave to making improvements in Utah. It was probably something in all my 10 years that I've never seen so much passion and motivation behind something. And, there was words and then there was actions, and everyone put actions behind their words. And
you get a bunch of CEOs together. We're going to make some things happen.
Yes. And that's kind of what we've been missing here. It's really that influential group of private practices and people. And there were people who don't currently have private practices, but who have been involved in, in the past or have a significant knowledge in it. And putting that group together and, preparing for that meeting, I had a big PowerPoint slide. I had talking points. I had what I thought we were going to land on, and it didn't end up getting used because we sat down and pretty much we opened the conversation. You talk about who you are, where you came from, what you do. And then we just laid out the question of what is impacting you the most at your clinics. What is impacting your PTs, what's impacting your bottom line, what's impacting the patients. And we went through about an hour probably of different things. You go through the typical prior authorizations, tough. You go through visit limitations that payers, you go through paneling on insurances,
credentialing, copays,
Yep, copays. And there's always a theme when you have a group of physical therapists together and PTAs about, it always circles back to, we just want the patient to be able to access what we do at a higher level without it being a barrier or, struggle for them.
Yeah.
And it always circles back to that. And so as we went through these conversations, it was brought up that several times that, we have this specialty designation in Utah that is our all encompassing issue, that is where all of these issues start, is this specialty designation. And because of this specialty designation, we have this umbrella that's holding the profession back in Utah.
Yeah.
And
it was so cool to see, a group of very passionate people that have all of their opinions come together collectively and say, we're going to do this together, hand in hand, and we're going to make this work, right? And it took you as an amazing leader to say, I'm going to listen. I'm going to listen to the needs of the members that represent all of the PTs in the state. And I'm going to really, truly listen to what needs to be heard. And you had your agenda. It was interesting to me, but then the agenda was kind of scrapped, right? And then all of a sudden we come together collectively. And then what did you see, happen with the level of engagement from these people as you listened to them and took what they said, and then you made action and started happening? What did you see?
I mean, I think that they bought in to what we wanted to do, essentially, because we were listening, and because it goes back to them being the experts, right? Like, I walked into that meeting knowing full well that I was not an expert in this, and I was not going to be presented as an expert, and I was not going to tell anyone in that room what needed to happen and what I wanted to happen. I had ideas in order to get the conversation flowing.
Yeah.
But I walked into that room knowing full well that those were the experts in the room, and those were the people who were going to teach me how to make it better here.
I love it. And we're going to talk about the next steps that we did throughout this process to get it to pass. But I want to kind of take a little hiatus here. What does this bill actually mean? And then what does it not mean as well?
So it's a hard bill to explain because it means a lot, but it also doesn't trigger a lot immediately. And
because there's multiple phases that action items that we're going to do after this.
Yes, absolutely. It's just that, and the work group that we worked with is 100% aware, and we were all committed to knowing this was a very first step into a process that we're planning to follow.
Kind of teeing up for the next season, right?
Yeah. And for us, this was our first step in a way to make all these next steps possible. But this first step doesn't necessarily immediately trigger something impactful.
Yeah. How long does
that's okay.
When you change a bill, like how long does it actually take to implement the bill across insurance companies, across the whole state, consumers,
patients? Yeah, it's gonna take a lot of work on our end, and so what this bill does is there's two different statutes in Utah that we ran this bill through. We ran it through the healthcare statute, and we ran it through the insurance code statute. And we had anticipated this would be a very tough battle, and often with legislative pushes, you have to find a way to compromise and, allow those who are opposed or even legislators to maybe accept it a little easier. And so in the health code, we added physical therapist and physical therapy as primary care providers in primary care. In the insurance code, we added physical therapy as an option for primary care, but it is an option and it's not required yet.
By insurances.
Tell
me what was the strategy behind that? So
we actually spoke with many different insurance agencies in Utah, and several of them had indicated that they would appreciate and support PT as primary care. And they would actually move in that direction if they had the ability to. But they didn't want to be mandated. And if, you know much about the Utah legislature, they don't like to mandate your insurers do anything.
Mm-hmm.
They want them to have the ability to run their programs and their policies however they want.
Yeah.
So mandating something right off the bat was going to be an even bigger fight than we thought we already had on our hands.
Yeah. I remember one senator said, "Why didn't you make this a shall, in the bill?" And we were like,
so you have that, I think he was a House member.
Okay.
He said that, and then you had the guy sitting 2 seats down from him who was super worried that we were mandating insurances to do this. And that's the trigger we didn't want to trigger this year, is that the insurers would come up and be staunchly opposed to this because we mandated them do something.
Yeah.
But we have heard and we have had lots of good conversations about insurers going to move this direction without us even mandating it. So we wanted to extend, the opportunity to them and say, if you're willing to, let's make this happen.
Mm-hmm.
WCF is already committed to having PTs as primary care.
Mm-hmm.
We're going to help implement
that. So any workman's comp cases can go directly to physical therapy. And what we see right now is they have to go to a primary care physician, takes a few weeks, they're delayed, and then they end up getting in a PT office. But the hope is, as we make this move forward, that they will be able to go directly to physical therapy.
Yes.
No delay in access. They'll be able to immediately get in. We know what happens to injuries after 4 weeks. Like, they just solidify. They take so much longer to get better. Like, it just, suffering for the patient. It makes no sense to go the route that we're going. Let's just get them to PT immediately for injury.
Yeah. And I think as WCF implements this, we're going to start to be able to get some data locally from WCF that it saves them money and it increases care, and patients are healing faster and, being able to recover faster. And so that is going to be a huge tool in our pocket to be able to go, if the payers aren't necessarily moving as fast as we hope they will. Yeah. It will be a huge tool in our pocket to go and say, this is what will happen if you remove the specialist, the copay, the high copay, or if you remove these barriers to PT. And so it doesn't trigger copays immediately, but APTA Utah is very committed to making sure it will. Yeah. If the insurers and the payers don't immediately start that, or not immediately, but if they don't start working towards that transition, we are committed to changing that shall in the legislation to that may to a shall. Yeah. And that's a much easier one-word change than the massive change that we did this year. For sure. So,
but I love that, because you give these insurance companies the opportunity to look at the data and say, we as a healthcare system are respecting and honoring conservative care first, and we're going to give you the option to jump on to save your consumers and you money, and ultimately get them a better healthcare experience, and reduce opioids, reduce unnecessary surgical procedures, right, and get people back to what they need to faster, right? So just to kind of summarize it, you're saying that we have increased access to care. That's kind of the biggest thing. It's like workman's comp cases, they have to go down this route. It gets them directly to PT. So that's one thing that's definitely happening. Yep. Copays, the hope is to eliminate copays.
Well, I will say that other states around the nation have run fair copay legislation to mandate it, and insurance companies have found a way around it. Yeah. So in our eyes, running primary care
was the first priority.
Yes. Yeah. So our hope is that you won't be able to find a way around this. Yeah. And if we work with insurers rather than against them, then they'll have an appreciation for the profession, and it'll be a more supportive role than it will be a combative role.
Great. And then the third thing that kind of is top of mind here is it gives the consumer the choice, right? PT for injury, MD for illness, in a sense, right? Go to the expert within that field to be able to expedite your healing, get you there faster. So those are kind of the big three things. Was there anything that I missed on what this bill truly means to both the consumer and our profession?
I think probably one of the biggest things is our goal is to elevate the respect and the value of the profession to patients, to insurance companies, to the public, to the profession itself. We have a hope that physical therapists can be seen as, PAs and NPs, and we look at that level of expertise and that level of
very similar level of education.
Yes, yep.
There's no reason why it shouldn't.
Reimbursement, the specialty designation has hindered the profession from being elevated to that elite role alongside NPs and PAs.
I think that's the most important thing that anyone that listens to this understands is that we are elevating the profession to a new level to be a navigator as a primary care role in musculoskeletal injury. Like, we just study so in depth. We put so much energy and time and expertise into this. It's about time we're respected in that way. And we own it as a profession too.
And that's important, that the profession needs to own it.
Yeah.
But I think that there's been a little hesitancy and a little lack of respect. And so we are hoping that this is a huge platform, not just for Utah, but hopefully we can support other states throughout the country to push this. This could be a huge platform to really say, PT is a high skill, high value profession.
Yeah.
Let's treat it like that.
Yeah.
Let's make sure we are advocating as a healthcare system for physical therapy and physical therapists to be able to practice how they're supposed to practice with the expertise they have.
Yeah, at the highest scope. I mean, that's ultimately what this is about too, is let's raise all healthcare professions to be experts within their field. Your role is not to jump into someone else's scope. Be experts what you're good at, right? 15, 20 years ago, MDs were the white coat for everything. They were meant to create the end-all, be-all, be the end-all, say-all, and they guided and directed everything. I can't imagine the weight of that, right? You're supposed to be a musculoskeletal expert and be over illness too. Like, there's just so much, and it has to be so deep in the level of education. You can't know it all. Yeah. Right? We have to rely on each other as experts within our own individual fields to raise healthcare together.
Well, and I think that there's such a mutual respect between physicians and physical therapists in Utah that it's only going to be improved by this. Yeah. I think physicians will be empowered to entrust more care to their physical therapists now. Yeah. And I think they already have a very strong belief in physical therapy, but I think there's physicians we have heard that won't refer to PT because of the cost or the barriers that are sometimes often there, or they don't know that they can. A lot of the barriers that we talked about. Yeah. And so I think this empowers also physicians to utilize PT more. And we've heard in Utah some of the data that primary care physicians are going to be extremely limited in the next several years.
My primary care, I can't even get into them for 2 months. Like, we need to do our part to assist in getting people better. Yeah. Primary care providers are just stretched so thin, see so many patients, and this just gives more access for patients to get better quicker. Yeah. I love it. Tell us what this bill does not mean. And then I want to continue the conversation of what were the last few steps to get this through the House and the Senate.
So this bill does not mean, sadly, that copays are immediately going to be triggered to be lower. And I want to be honest about that because I know everyone's very excited about the potential for that.
Like, just change overnight, right?
Yeah. But this has always been a very, there's been a very big understanding that this is a process and this is the first step. And part of that process is going to be pushing for to remove that higher copay. Yeah. And that is probably one of the top of our lists. But this legislation will make that much easier. Yeah. It doesn't trigger the lower copays immediately. It doesn't increase reimbursement immediately for PTs. Obviously, there's some concern with the primary care role that they're just going to be practicing they're going to have more to do with less pay, with the same pay. That is part of the advocating that we will do to increase reimbursement alongside our private practice clinics during contract negotiations.
And if you look at the bill, it says specifically in one of the bullet points that something along the lines of, if your primary care role, you're entitled to increased reimbursement rates. Am I saying that correctly?
I don't remember that line, but that sounds nice.
Well, maybe I just made that up. We'll see. I'll have to go back and look at the bill, but I'm pretty sure there was a line that said something about increased reimbursement rates.
Oh, yes.
Because of the
I know what you're talking
excess
about. Yeah, so in the insurance
load.
code, that's the may or shall. It says you may not charge a higher copay for primary care providers.
Yeah.
Or you shall not. But PT got the may. And that's part of our, and that's part of our initial step to allow that collaboration with insurance companies and to gather the data from WCF. But that's why the mention of we could change that to a shall.
Love it.
Easily in the future. And seeing how much support we had from legislators, I have hoped that would be a nicer, easier process.
I love it. So you got the work group together. We're kind of going through this evolution here. You got the work group together. You listened to them. You listened to their concerns. You created action. We got a lobbyist, right?
We have Mike
And
Sontag. He's
then
great.
what was the next few steps to get it to the House and the Senate?
We had to find a bill sponsor. Luckily, we shout out to Senator Musselman. He's incredible. Such a great senator. We are so grateful for him. And he had worked closely with some of...
He did such an awesome job.
Yeah, he's really great. He worked with some PTs and has had some PT in the past and was a really good advocate for the profession. So we got him on board, and he was willing to make a priority bill, which is, they are only limited priority bills. So we were really grateful that he was able to give us one of his few. And then we went into drafting the language. I mean, I had already written what I had anticipated the language would be. And so they just took what we had agreed on at the payment work group, essentially, and moved it into the legislative council, the group who rewrites the legislation, their staff. And then we moved into, we got it released publicly, and we started to build our group of who was going to be active up on the Capitol, anticipating that we were going to need to be...
Yeah, you got everyone on a group text. And it was like, we need you noon today.
Anticipating that we were really going to need people constantly to really advocate for this.
And it was cool to have all those private practices on that have all the access to their therapists. Like, anyone can drop a hat and be there in 3 hours.
Yeah.
Right?
And we had the first time we had everyone up there, we had a solid group. And having that group up there essentially moved votes from an opposition to a positive, just because we had people who were constituents of these specific legislators up there on...
Oh my gosh, that was so huge.
It was huge.
And you literally put together a list and said, everyone reach out to your senator, right? And you made sure to check off every single one.
Yeah.
And everyone was involved. Like, we got the word out and made things happen. That makes... I talked to one of the senator's assistants, and they said, yeah, we track every single one. Right. And if no one's saying anything, obviously it says that this bill isn't really a huge priority. Yeah. Right. But they check off and they say, oh, there was 50 people that called in specifically for this bill of your constituents, people that you represent. And they're like, well, I guess this matters to them. Right.
And that's one thing that we have to remember here in Utah. I can't speak for around other states around the nation, but they really want to hear from their constituents. And constituent is the people who live in their district, the people they represent, the people who essentially are voting for them. And so when we were able to connect...
I'm glad you defined that, because I didn't know what it was before this whole process. So
I assume everyone does, but I would imagine that's not the easiest word to know what it means. But so we were able to kind of pinpoint specific people to specific legislators and have them call, have them text, have them on site. Yeah. Then we went through the first legislative committee. We had Chad Teeney, who's the APTA Utah Legislative Chair. He sat with the sponsor. We had Howard Quackenbush, who's the chief delegate. He's a rural PT. And it was really fascinating to see the committee hearing happen and all the support that we got. And we had a couple people who mentioned that they had some concerns from some of the people that have reached out to them, but it was a unanimous decision. And from there, we really didn't have much pushback. All we got was, well, gosh, we love PT.
It was
every
so cool.
step of the way. So we'll take it.
Tell me, in your role, I mean, maybe we've kind of talked about this a little bit in the past, maybe not feeling in your role that you had the right support. Tell me what this did for you personally.
I think in the years past, we've had some really great boards and we've had some really engaged boards. I think we've always lacked the involvement of the private practice community.
Mm-hmm.
And I think that is because we weren't really doing much with payers and with reimbursement.
Yeah, they didn't see the value.
They didn't see the value. And because of that, I didn't really learn that realm. I wasn't really hearing much about it.
Yep.
It wasn't really on my radar because no one was talking to me about it locally here very much. And so when we got this group together, it was amazing the amount of knowledge and expertise and insight you could get in such a short amount of time. And to hear what's been impacting them and how we could improve that, it was just amazing to finally get, this is what we want you to do. This is what we need help with.
And the thing is, your role wants to know that from your
for sure.
PTs, your PTAs in the state more than anything else.
Mm-hmm.
I mean, you constantly are reaching out to our profession saying, what is it that you want? Mm-hmm. But then you hear all these complaints and you're like, well, what is this? What can we help you with? What can we drive forward? Right.
And I think one thing I've been thinking about this a lot. Want to make known is everyone has amazing, incredible ideas and what we should be doing. And oftentimes they're very overreaching and they're very broad.
Mm-hmm.
And when it came down to this primary care thing, we have to start small sometimes.
Yeah.
We can't always think to ourselves, okay, we want this, we're going to just go get exactly that. Sometimes we have to start small and find the steps before that.
It's an evolution.
Yes.
It's we're evolving and we're coming better each year and each day. Love that.
And when we have this goal in mind, we went backwards and how to figure out how to get there. And we are on step 1 right now.
Yeah.
And so if I were to give any advice for any chapters or anyone who's looking to do anything like this, start small.
Mm-hmm.
Find the small thing that you can do now and that achieves the mission tomorrow,
Mm-hmm.
So that's what we're doing. We're not starting with this. I mean, it feels big and it looks big, but for me, we're starting at the basic step.
Yeah.
To make this happen.
Well, you even think about, back in the 80s, we got direct access. Not every state has direct access, right? We got imaging. We can order MRIs, x-rays, right? There was a huge push for that. And then you got disability placards. So we can, a patient comes in and they want a placard to be able to park closer to a grocery store. We can do that now, right? Mm-hmm. It's been an evolution. We didn't just get primary care just right off the bat. We had to prove ourselves along the way. Are you skilled enough? Are you trained enough to be able to do these steps? Is it appropriate for a doctor of physical therapy to order imaging, right? We had to prove that. Yeah. It had to be in our education. We had to spend time being experts in those roles. We had to actually show it and gain the trust of society. And that's why we could pass it, right? Mm-hmm. So each state has to look at and say, okay, where do we start? And then just start that movement and work at that little thing and start picking at it and then keep moving to the next one. Well, this was not just this year. This is the last decade you've been working on these things.
That's what I think of the may and shall is look in your statute, look in your regulations. Is there one word in there from a may or shall that you could change that may not require something but might give it an option?
Yeah.
For example, Utah right now, we have a long list of 15 plus items that we're going to be working towards. We're meeting with our regulatory board. We met with them last week.
If anyone doesn't know what APTA Utah is doing for you, just come ask. It is so in depth. Katie is working relentlessly to support our profession, and there are phases, there are steps. And I should say, Katie, there's so many people that you're leading, right? You're like, okay, who's the expert in here? Let's get them in. Who's the expert here? And you're creating this movement of people, of experts in their individual fields, and essentially you're kind of primary care, right? You're saying, okay, I'm not the expert in there, let me pull you in. Mm-hmm. You're the expert, right? And then you're driving it forward and creating the next initiative and communicating to the public, marketing to the public. And then you got all these hands that are doing these individual parts of all these experts. And it's so incredible to watch.
Yeah, and I think that like it's nice to recognize when you're not the expert in the field or in any of it. I mean, I can guide and lead and provide insight, but we had a question this last legislative session about animal physical therapy, and I go to the board, and the board we're not really experts in that.
Mm-hmm.
So we find the expert in it. So really identifying who's an expert in what and capitalizing on that.
Yeah. I want to hear, what are your thoughts on kind of APTA nationally involvement, and what kind of call to action do you feel like we could do nationally to support our local chapters as you've been through this experience? I mean, we're the first one to make this happen in the nation. We are driving from the front saying, we're going to lead this, right? But what action items do you have for, or advice that you have for our national supporters?
Yeah, I mean, I think national is so incredible with the work they do at the federal level. They are very engaged. It's near impossible to do anything federally, but they are moving mountains and making progress. And
I think it's so important for our members to hear that. I mean, if you knew what work both nationally and state is doing,
yeah,
$100 $250 for your membership fee is nothing.
No, and I think you hear so often like APTA doesn't do anything for us for payment. You're just not paying attention. APTA does so much, and you're hearing even recently we've had so many various wins, and they're not monumental. Sometimes they are, but a win is huge when you can get a win federally or nationally. So they are doing incredible work, and if you don't think they are, it's probably because you're not paying attention or you're not involved in it.
You're not engaged in it, yeah. You're just thinking like, oh, who's going to come to my front door, knock on it, and say, this is what we're doing?
Yeah.
Right? Be engaged, be listening, be watching, be reading.
Yeah. And if you want to be engaged, I would say it starts at your state level. If you really have frustrations about the profession, get involved at your state level. That is the first place to go when you want to make change.
Yeah, and a lot of people think it's like mass time consuming.
No.
There's so many positions that's just very simple that you can be engaged in.
I like to say that the board at a local level is the guide, is the vision, and if they have time, they are put actions. But really, the most impactful thing you can do to be on a PT board is to share your expertise, what you're seeing out on the ground, in the trenches.
Be the guide,
be the
navigator.
Because for people like me who aren't out there every day, I don't know what your experiences are unless you tell me. I think that there's some improvements, and I hope there could be some improvements with this process with national. I think that there's a lot of different issues that states are pushing, and I wish there was either more support for their state affairs team, because there's a 2-person team and they do good work. But there are way more than 2 states.
Yeah.
So I wish that they had a more robust state affairs team.
Could definitely.
Where when we run something like primary care, there could be more influential and more support for that.
They could essentially be an assisting, saying, hey, let's collapse time for you.
Yeah.
We've done all this research. Let's just kind of speed it up. I mean, we've talked about DME, the medical equipment that we're prescribing.
Yes.
Physicians, we have to get their sign off on that. It's like, we're prescribing a wheelchair and we have to get a physician. Most of the time the physician's like, well, what do you want? Yeah, you just need my signature. Cool. Right. But those are things that we can expedite and get faster.
And they do provide a lot of resources and guides on it. I just think that like having more point people to be directly engaged, or to even go to the states and say, why don't you push this? This would be something you could do in your state.
Absolutely.
Because states like ours, we don't even know what could potentially be successful until we start down that path. But if national were to take more of a lead in that and say, hey, we would like to really see your state push for this, and this is how we can do that.
Yeah. With our last few minutes here, let's give advice to 2 different groups. One, our PT members in the state. What call to action do we have for them? And then what call to action do we have for consumers, the patient?
I think for the professionals, PTs, PTAs, be an advocate for your profession, be confident, be an expert, be passionate about this change, share it loudly, and use it in
Tell every single patient.
Use it in everything you do.
Oh man, since this bill has been going on, I've been telling literally every patient, and they're asking me like, did it pass? Did it pass? I'm like, yes, it passed.
We have
the governor signed
what's to come. We're going to have some education. We're going to have some toolkits. We're going to have some resources for physical therapists and physical therapist assistants to really implement this in the way they practice physical therapy and how they work with their patients.
Do not miss this next conference.
No.
This conference is crucial to know what this truly means and educating you on what you can do to take it to the next level.
And a huge thing will be the education we give to physical therapists on how they negotiate with their payers and insurers. You are going to be able to use this in your negotiations to increase your reimbursement rate. And we will be providing some information on that. When we look at patients and the community, you have a unique role in being able to advocate with your employers, your insurance companies, to increase your access to physical therapy. And them being able to go to their networks and say, you know, PT is primary care in Utah. Why is it not implemented in your system? And we're going to be doing some big PR campaigns to encourage patients to do that, and also educating them that primary care, PT is primary care. So
tell me if members nationally, locally need to get a hold of you, what's the best way to do that?
Well, we have the aptautah.org. You can visit that. There's going to be some good information on there. We have all our social media pages that anyone is welcome to follow. My email, Katie, Katie, at aptautah.org. You're welcome to email me at any time.
And this is, I just want to advocate for this. Katie listens. Like, I think, what we've talked about today, she represents our profession in Utah. Right. So she wants to hear these things. She desires to hear these things. She can't, drive change for us if we're not speaking up. Right. And she's not a complaint sister or a complaint line. This is purely if you want change.
Well, the one thing I would say is if you have an idea and something you want changed, I would love to see you join us in making that happen.
Yeah, be the change.
If
Don't
you
just
have
talk about
something, you can mention it and you can bring it to us, but I'm always going to invite you to be engaged and help us make it happen. And because we are so limited on resources and time, and we need your help, honestly.
Yeah. And everyone does a little bit. It makes a big difference. Mm-hmm. What I love about what you say, you get people that are passionate about the thing that they're talking about. You are passionate about that. Come join us. Yeah. Let's do it. Let's hitch our wagons together. Mm-hmm. But ultimately, you're turning it and saying, okay, you want to make that change? Come do it with us, and we'll support you. We'll help be a driver. We'll be in action. But I love that, and I love all the things that we've done. I mean, it has been incredible to watch the entire state come together as one, hand in hand, and make this bill happen. We will be primary care providers. We are. We just passed the bill. We just need to believe it. We need to go out and do it and be confident in it in our profession. And we will make a world of difference. In my opinion, PT is the best kept secret in healthcare. Mm-hmm. And we're going to make some big change. So thanks for joining us today, Katie. It's been an absolute pleasure. And thank you for all you're doing for our profession.
Thank you.